Do you want to say something, Marian?
Yeah, thanks very much for your suggestions. I just wanted to respond to a couple of them. Um, One of the problems with using vital statistics data to analyze mortality is that we know whether the home birth is planned or unplanned, but we don't know whether the hospital birth is planned or unplanned. And the thing you could get from that is the transfers. Like a woman starts laboring at home, and then she's transferred to a hospital because of complications or something like that. Right now, we don't have that data. And those cases, they might have more bad outcomes or something like that, possibly. So I've been reluctant to analyze the mortality data because it's very difficult to be comparing apples and apples. Um, just in the past year or two, Oregon, I believe, is the first state in the country to add this to their birth certificate so that they can actually identify births that started at home and were transferred to a hospital due to complications. And we have high hopes that once that data starts coming in, we can do some good analysis with that. I think the other problem in comparing home birth to hospital birth using vital statistics is getting mothers of the same risk. You want to be able to compare apples and apples. And vital statistics is a kind of, it's a kind of broad brush kind of instrument. It's not really that detailed that you can get all the information you need on risk to do like a case control study or something like that. So I think those are the two main factors that have made us hesitate to use vitals to analyze neonatal mortality. Now, I mean, there have been a number of studies done based on birth center data or so forth, and I know more studies underway that look at mortality. But I just personally haven't felt that the data I'm using is strong enough to really do that well. And I don't want to do it poorly because I know it's a very controversial issue.
It is a fraud issue, and every time you look at it, you're at risk from one side or the other. But I would say that even if you didn't know about the ones who were transferred in, if you at least had some sense of what the rates are in those actually delivered in birth centers, were there any kinds of unusual mortalities such as we saw? I mean, the birth of that baby in Okemos, Michigan was in the birth center. Now, I agree. And in fact, if the birthing centers are recognizing risk and transferring them to hospital, that's what they're supposed to be doing. I mean, actually,
It's not.
in the 82 report, we had a very nice table. I refreshed myself over the weekend. Ruth Lubick, some may remember that name in this audience, was a great advocate for a birthing center. She established the first birthing center in New York City back in the 70s, I think. And she showed a diagram of how women flowed to her. And really, a huge number of women had been moved out of that option well ahead of labor for various complications, very carefully done in prenatal care assessment. This was before ultrasound. A lot of women were moved for breech and for other things. And by the time you got down to the end, you had a very low risk. And so that movement is actually positive, even in labor if necessary. But I agree that vital data are only a starting point and can't answer. I wouldn't go so far as to say, because we can't really fully answer, we shouldn't answer it at all. We should, I think, attempt to deal with what we have with the limitations. But I think, for example, I'd like to know what the adverse outcomes are in planned home deliveries where that's available and in birthing center deliveries, just to know how they are. And then selecting a comparison group is difficult. I agree. It may require a lot of work. There is still a goodly amount of descriptive information on the birth certificates, but it might require a more extensive look. But certain events would stand out just as they shouldn't happen. We shouldn't see very many intrapartum fetal deaths in birthing centers, right? I mean, so I think even without a denominator, they're of interest to some extent.
We definitely have that data, and I've looked at the data, and infant mortality rates for home and birthing center deliveries are low, on the order of 1 or 2 per thousand. But again, without a comparison group, it's been hard to put that data out there.
So that was nice discussion. I think we're going to have a panel discussion at the end after panel 2 goes ahead. So now we're going to have a 15-minute break, is my understanding. And so you all can stretch, but we need to reconvene by 10:40 in this room.